OrthodontiCell is pretty simple. It's for patients that want to have straight teeth. Typically, you're going to use braces or aligners. We, OrthodontiCell, have a medical device that works in conjunction with braces and aligners, and we shorten that time frame from 18 plus months down to 6 months. And we do that through technology.
Now, everybody, don't tune out. Don't turn off the podcast, okay, people? Hello there, everybody, and welcome to another episode of the Orthopreneurs Podcast. I'm your host, Dr. Glenn Krieger. Now, today, I need you to sort of bear with me here, folks, today, because we're going to talk about a product that is potentially going to revolutionize the delivery of orthodontic care. I'm not kidding. Now, you've heard this before. We've been promised things from companies that didn't deliver. Some were charlatans, some were just misguided. I'm telling you, listen to today's podcast. This product is so revolutionary that I invested my own money in it. You'll have the opportunity to do the same thing if you believe in it. But I'm here today with Mark Terrill, CEO of OrthodontiCell. You've not heard of this company yet, but you will. And welcome, Mark.
Thanks, Glenn. Thank you for having me on the show.
Absolute pleasure. And I'm really excited about this today because, you know, we live in a country where you're innocent until proven guilty. But on the topic we're going to talk about, unfortunately, you're going to be guilty until proven innocent. I know this. I'm an orthodontist. I practice. I've heard the claims from other companies. I've seen people promise things that they never delivered on. But I know the founder of your company, who is an orthodontist, who's one of the best orthodontists I've ever met in my life, who I was literally going to work with in his practice until we decided to move out of Florida. So, folks, as you're listening today, we're going to give you some background on the company. We're going to give you background on the studies, and you'll be able to make your own decision at the end. But here's the thing. There's a lot more to come from a scientific perspective. And so I'm not asking you to believe in anything other than what you hear today. But let's start with this, Mark. You're the CEO of OrthodontiCell. Talk to us a little bit about who you are, what your background is, and sort of, we'll get into the how you ended up with OrthodontiCell afterwards.
Sure. Thanks. Absolutely. And pleasure to be here. For me, I am from California. I've lived at the beach my whole life. And now I live in Florida. So grew up in Newport Beach, California. My parents are from the Midwest. Dad was a Marine. So we're big into patriotic type things. And we went to USC, University of Southern California. Dad actually worked for Reagan eventually, President Reagan. So
Wow.
They moved to Annapolis, Maryland. I finished my school at Maryland and got accepted to Johns Hopkins Medical School. I was going to be a physician, but I played some sports and thought that was a much better avenue. I did that for a couple years, one did he good, and got into the medical device sales. So that's how I got into this business.
Right on. So you're the guy who got into Johns Hopkins Medical School and thought sports was a better option.
Yeah, look at today. Everybody's rich and famous and they have lots of money, but I love what I do and we're still here helping people.
That's awesome. So I know you've had experience with the medical device world. Are you at liberty to talk a little bit about some of the successes you've had along the way? Because again, I know you're not going to toot your own horn, but I'm going to get you to toot it for us because I think one of the calls to action through this podcast, if people like what we're talking about, they're going to want to learn more about potentially, how do I get in on this thing at the ground level and be a part of it? And I think the CEO and the person who's running the company is a large part of what helps sway people in terms of deciding whether or not they want to be a part of a company or not.
Yeah. So a little bit about me, as I mentioned, got into a medical device, started in sales, but early on, I have gotten into the startup world for about the last 20 years. So I have done previous 7 startups, been very fortunate enough to have 2 exits. I recently just took a company of last year through an IPO. And I've also been very fortunate to have built up real good teams around me, but I've taken 2 companies from 0 to 100 million in 2 years.
Wow, that's impressive. So you've been there, you've done that. And I want to be crystal clear with everybody. Again, I always want transparency. I am an investor in the company because I believe in Mark and I believe in John Marchetto, the orthodontist who I was going to work for, who became a friend over the years, who's one of the most accomplished, smart, he's now retired orthodontist that I've ever met in my life. He didn't retire because he made $500 million, which he very well could have. He worked a very long, illustrious career. He was one of the first people in South Florida to ever bring bone plates with Hugo de Klerk and all that stuff, and Junji Sugawara. I mean, we're talking somebody who graduated from Boston back in the day when Boston was the place to graduate from. Not saying it isn't anymore, but he's a phenomenal orthodontist and has taught me so much about what I do. So I want everybody out there to understand that this was a company founded by an orthodontist who is a tinkerer. Again, transparency. Doug Shaw, my partner, and I rebuilt my head gasket, did my lifters and my valves in John Marchetto's garage because he had a lift to put a car on. So you're talking about a guy who from day one is a tinkerer. He doesn't like a problem. He wants to fix things. And he saw a problem in ortho and he came up with OrthodontiCell. And so tell everybody a little bit, if you don't mind, what is OrthodontiCell? And again, everybody, I don't make penny one if you invest in this company or don't. I've invested in it because I feel it's a great future value. If you do, great. If you don't, you don't. But just know I don't make a penny if you invest or if you don't invest. Just being clear about that. So, Mark, what is OrthodontiCell? I know people are probably interested in hearing that now.
OrthodontiCell is pretty simple. It's for patients that want to have straight teeth, and typically you're going to use braces or aligners. We, OrthodontiCell, have a medical device that works in conjunction with braces and aligners, and we shorten that time frame from 18 plus months down to 6 months. And we do that through technology.
Now, everybody, don't tune out. Don't turn off the podcast, okay, people? Because I know right now what he said are promises made by other companies through the years. We're going to take 18 plus month treatments and make them much shorter, right? And this is the moment, if you're like me, you tune out because you've heard it, you've been promised it, and with very few exceptions, they've never delivered. So I'm sorry for cutting you off there, Mark. I want to make sure people keep listening to the reason why this one is so radically different than the others. So
correct.
I'll let you continue. I'm sorry.
Sure. No problem. And so this is really done at the cellular level. As Glenn had mentioned, John is co-founder. He was an orthodontist for many, many years in South Florida, and he developed a waveform that specifically targets proteins that ultimately, the first one is rank ligand. Don't want to get into too much of the deep science. But typically what we do is we put the electrical therapy in a mouthpiece that fits over top of aligners or braces for 25 minutes twice a week at home. And during that time, with the waveform, it ultimately loosens at the cellular level. Then we straighten the teeth and then we cement them in using other waveforms targeting other proteins. But in a nutshell, that's it.
Yeah, and I'm going to translate for everybody out there so you understand what we're talking about, because I have personally used this device on myself with aligners. Okay, so it's not vibration technology. I'm saying that now. It's not screws or bony insult or anything like that, right? What it is, it's actually using electrical conduction waveforms, as he's talking about, to help stimulate bony changes through rank ligand, rankle, and all the things we learned about in bone physiology. This is not new technology. We're using it for orthodontics, but it has been used in bone healing, right, and other things for years and years and years. This is not the first time someone's done this. But John said, you know what? If it works on other bones in the body and has been proven in the scientific literature for ages, why are we not using this to stimulate osteoclast, osteoblast, to do all this stuff that happens in bone physiology? So I'm not going to have Mark jump into the science of it. I believe I did a podcast with John a while back. So if you guys search through my podcast for John Marchetto, Marchetto, the most honest orthodontist you'll ever meet in your life, one of the most humble orthodontists you'll ever meet in your life, and one of the most accomplished orthodontists you'll ever meet in your life. If you want to talk to him personally, he'll go through the science with you to a depth that you don't want to dive into. But this doesn't work by vibrating teeth. This doesn't work by seeding aligners. This works by stimulating the physiology to create faster bone turnover and get teeth moving faster. Period. Did I say that okay, Mark?
You're exactly correct. It's bioelectric stimulation is basically what it is.
Exactly. But when you hear that, folks, in your bioelectric stimulation, the first thing you're thinking about is some corny, weird thing. No, it doesn't work like that. I've used it myself. It's comfortable. I believe the protocol is to use it at least twice a week for 25 minutes per time, right?
Correct.
Which is how I used it. So I hope I was using it right. And basically, I sit on the couch watching TV with my wife and I pop it in over my liners, 25 minutes twice a week, and it works. Now, when we talk about and it works, don't take my word for what happened with me or didn't happen with me. That's unimportant. We, and I say we, OrthodontiCell, as an investor, the company has already gotten a preliminary study done in Brazil, has it not?
We have already completed a study. It was actually published in December of 2023 in the AJODO journal with the caption, Best Evidence.
Right. So there's already been something started. But at this point in the game, just to let everybody know, I try to advise technically. They have people who help them. I'm trying to advise them technically about how they need to pass muster with orthodontists. I told them very clearly, if you don't have legitimate science behind what you're doing, and John knows this as well, if you don't have legitimate science behind this, it ain't going to pass muster. And I'm not talking about, look, a case study. We all know about the hierarchy of scientific evidence. Legitimate studies, multi-center studies have power in your study to make it worthwhile. Nobody's going to care, right? So real quickly, do you want to talk a little bit about what we, as a company, what OrthodontiCell has planned in the future?
Based on the study information, it is a device that we're currently going through the FDA process. So what does that mean? We are going through the biocomp testing and the electrical safety testing. That should be completed within a couple weeks. We have already had conversations with the FDA and they've approved our study design to do our human studies. Those will be starting probably in July, and they will be 3 sites with about 30 to 35 patients each. And that is the FDA study design.
Hey, everybody, tickets for Summit 2025 are on sale now. Take a listen to what some of the attendees from Summit 2024 had to say.
This is one of the most unique, most impactful meetings that you can go to as an orthodontist.
It has everything compared to other meetings. Entertainment, the content in the meeting, the speakers, the food.
I learned a lot. It helps the practice, so it really kind of checks all the boxes.
You hope to get something out of it that is going to pay dividends for years to come.
Definitely return on your investment.
We take back a lot to our office.
You get information that you probably don't get easily at any other meeting.
Just to be clear with everybody out there, they've already used this in humans in Brazil. I saw years ago, at least 2 years ago, I saw the results and the time that they used it. That's not what we're counting on in the future. But we saw that preliminarily, call it almost a pilot study, to see how it worked. And the results were incredible. Now they're actually going to go legitimate study, multi-center. You should just know that the people who are going to do that are likely going to be chosen from the Orthopreneurs RD group, because I know them. I know who they are. I can trust them. Most of them are amazing clinicians. And so we're probably going to draw from that. And again, there'll be a fair number of patients who are going to be used in it. And I've already brought this out to a number of the members of our Orthopreneurs RD group. And they're, John gave a presentation when we did our ski meeting in Deer Valley in February, I think it was. And most of the people in the room said, how do I get to be part of this study? And so that's probably taken care of at this point, more than likely. But here's the thing, folks. In order to put these things forward in a study, there needs to be funding. And we're going to get to that in just a minute or two in terms of what does that mean to need funding. Well, you know what? Let's hit it now. We're already on it. If somebody hears about this and says, a mouthpiece, electrical conduction, studies coming out, what do I do if I want to get involved on the ground level? Because you really are ground level right now. What does that look like? What does it mean in terms of if somebody says, I'm interested, I want to learn more?
I'll give you my contact information at the end of the podcast. But really what that is we are raising currently $6 million to get through completion of the FDA process. We do expect that Q2 of 2026 and then start commercializing immediately after that. Part of that $6 million is to prepare for commercialization. So we don't need all that for the FDA piece.
Got it. Because the expectation is it works. You know it works. I know it works. I've seen the cases, but we need to bring you into a formalized study to make that happen. And so I know we have never discussed this before. Is there a minimum investment that people need to make to be a part of this? Or, you know, when I say this, it's going to sound cheesy, but no reasonable offer refused, right? Like, I know somebody has to be a qualified investor more than likely, right?
Yes, they all have to be qualified investors. And, you know, from the tax people, you can find out what that is. And from a minimum investment standpoint, there isn't a minimum. We do have a cap table that's there already. I guess I would like that to be potentially in that 25 or 50 range. But at this point in time, we don't have
folks. You have to give $25 to $50 million each. I'm kidding.
There you go.
$25 to $50,000. Which is what I've seen for most of the startups that I've ever invested in, have been in the same range as that, right? Is there a maximum someone can put in?
No, I'm looking for $6 million. If that's one individual, they'd be my new best friend.
I know this is a really bad dad joke I'm about to say, but you're officially the $6 million man. I can't help it. Sorry, folks. Yeah. I'll be here all night. A little Lee Majors 1970s $6 million man joke. If I'm thinking about wanting to invest in this, and again, John covered the science on this beautifully in his podcast. We're not going to dive deep into the science behind this because he did a great job explaining it. But in terms of the investment itself, people are going to learn a little bit about investing in general right now, right? Let's say you don't want to be involved in OrthodontiCell. That's your right. It's okay. But don't tune out just yet, because I want you to understand, if you're ever going to be talking to a company about investing, what are some of the things you need to be looking for when you talk to them? So Mark, you came to me, I would like some money. And I say, okay, I got $50,000 right here in my pocket, Mr. Terrill, that I want to give you. But how do I know that we've got any future whatsoever? I mean, you're telling me that, you know, there's going to be some studies and you need this money to go commercialization. But how do I know that there's any interest out there whatsoever in getting this product to market?
Generally speaking, there's a couple ways to do investing, right? There are what is called a term sheet. I'll go through that in just a second. There's called a letter of interest. Then we're talking about equity. We're talking about a safe note, a convertible note. All these factors are out there. Right. As an example, I actually do have a term sheet from a venture capital organization out of New York City. Term sheet. What does that mean? They have come to me. They've done all the due diligence. They checked us out. They looked at all of our financials. They looked at everything that we've done. They checked each of us out that are executives with the company. So all that due diligence has been completed. So the term sheet in this example is we have a valuation of the company, and for their $5.5 million, they get 14.5% of the company. That's equity. That
like
is a stake in the company. Yes.
Like Shark Tank. Yeah. I'll give you $100,000 for 20% of your company.
Correct.
Yeah. Okay. So for 14% of the company, they're going to give you $5.5 million.
Correct.
Now, folks, if you ever watch Shark Tank, I'm not an avid watcher, but I probably watched a couple of dozen episodes along the way. Do the math, folks. 14% is roughly 1/7 of the company, right? And they're willing to give him $5.5 million for 1/7 of the company. That makes the valuation of the company somewhere around $38.5 million, give or take. Am I crazy here, Mark?
Those are the numbers.
Okay. We have not talked about the numbers, so I just want to tell people he hasn't divulged that to me. I'm just using common math that we all know about companies. So that's one thing you've got. What is something else you got?
So I do also have an LOI, which is called a letter of interest, actually from a family office in Europe. They're actually in Switzerland. And we just got that. I just received that last week. We are starting that due diligence, but we have a data room, and that's where you put all this information on the company so somebody can review it. And we already have it there, so it's easy to do for the family office. The family office letter of interest states that for $6.5 million, that they are going to be getting 15% of the company.
Nice. I feel like I'm on Shark Tank, right? And what is Mr. Wonderful offering? But for those of you again out there don't know what a family office is, very common term. Typically, as its name would imply, it's an investment house that manages a family's interests, right? And usually, from what I understand, I've had a couple of friends who've been family office advisors who've run family offices. I think generally speaking, the bare minimum to make it make sense is probably about 300 million, right? Give or take.
Yes, that is correct. It needs to
Yeah.
be significant. And most of the family office money is generational money.
Right. Yeah. If you decided to invest in this, or you pulled out $50 million, you're not close to a family office. The costs would break your back per year. It wouldn't make any sense. But family offices are significant wealth, generational wealth, generally, in the billions of dollars, not just the mere, hundreds of millions of dollars. I mean, that's my ATM fast cash setting, to be honest, is 300 million, right? But yeah, what he's getting at is you have very stable financial institutions that are looking to invest in this product right now. And so that's worth mentioning there. So let's now focus a little bit on the concept of the office use of this, right? So there's a number of ways people can get involved in this, but ultimately, if I'm not mistaken, Mark, people are going to buy the product like they would a toothbrush or any other medical device. The clinician is going to buy this from OrthodontiCell, and then we'll get into what they do with it, right? The plan is for orthodontists to be able to buy this from OrthodontiCell, right? On a per unit basis, in bulk, in little, however they want to do it, correct?
Yeah, that is correct. We consider it quite a prescription device, even though it's not. It's run through the orthodontist, the professional office. It's not sold on Amazon or CVS or what have you. It is run through the office, yes.
Right, as well it should, right?
Yes.
Again, unlike the other technologies we've talked about, this is not a vibrator that you bite on and seats a tray and create some response. This is a real medical device. About the size of a pack of cigarettes, right? Fair way to describe it?
Yeah, I always use it. That's about the size of a small cell phone. And then we have a cable and then a medical grade silicone mouthpiece that again fits over top of the braces or aligners.
Right. And again, 25 minutes twice a week. That's all you're asking people to do. More is not better. And turning up it gives you an ability, having used it, to turn up as the old pump up the jam, you pump it up. No, you don't have to pump it up anymore. Then the moment you feel anything, it's working. So more shock, if you will. And again, if you turn it way up and you're a little kid and your dad made you taste the 9-volt batteries, you put your tongue on the 9-volt battery, that's a pretty significant, tingle. This is far less than that. The moment you feel a little bit of pins and needles, so to speak, it's working. And supposedly, even if you don't feel the pins and needles, it's working. But the feedback to the patient that the little pins and needles is the indicator that makes them feel good to know that something's going on, right?
Yeah, you're exactly right. I mean, once you turn it up, and we have a gauge from 1 to 10, most people are in 5 to 6. And actually at 1, you're getting the same results you are at 10.
Right.
But again, people want to feel something because they want to know, is it really working? Right. And so we say, turn it up to where you feel it, and then leave it there or back it down 1.
Yeah, that's what I do. I turn it till I feel it, then I turn it down 1 so I know that it's on. I know it's working. It's kind of like when they put the smell into the gas lines. So people, if gas escapes, at least they can smell it. Same thing here. As long as you can feel it, it's working, you'll tune it down a little bit. And you'll literally sit there watching TV or working on your computer. I'll do clean checks while I have it sitting there. And 25 minutes later, it automatically shuts off and you're done. Mm-hmm. And it moves through, I think, 4 distinct different wave patterns, if I'm not mistaken, right?
That is correct. They each are targeting specific proteins.
I can tell what each one does.
Yes.
And so for orthodontists, right, of course, there's a lot of ways they can structure the model in their practice once they have this device. And again, let's assume, everybody who's listening, that the studies come out, they validate everything we're talking about. And let's not get into that conversation right now of, well, it won't work or it does work. We're not having that conversation right now, right? Studies, multi-center studies are going to happen. Hopefully they'll validate exactly what's happened so far. companies aren't going to come to you with money to give to you if they think your product's going to fail. So let's go on the assumption when we talk about using it in office that the product has been proven to be effective and it works. Okay, everybody? That's where I'm starting this conversation. So let's assume someone wants to get involved in it. They're going to buy units through a prescriptive kind of way through the company. They can either they could probably mark it up and sell it to patients as an add-on if they wanted to, or they could probably just build it into their case fee, increase their case fee, and build it in, right? I mean, are those kind of the models that you guys have thought about?
Yeah, absolutely, Glenn, because it's up to the orthodontist. But yes, you would buy it, and however you want to do it to enhance not only the treatment of the patient, in other words, reduce some time and build in some other time for the office. But again, you can also use it as a marketing tool to be one particular orthodontist in an area that says, hey, I have a different way to do things. And so you can be used in the office that way.
Yeah. But again, just going back for a moment, they'll buy it from you and they
Yes.
can either charge it to the patient and say, hey, if you want to cut down your treatment time by 50%, you can buy this unit for X amount of dollars, or just say, hey, your treatment is going to take 18 months or 14 months or 12 months or 6 months or whatever they're comfortable saying at that point after they've used it a few times, and say, this is your fee. And by the way, it includes OrthodontiCell. And what does that mean? It means that you or your child, your treatment's going to finish faster than the person down the block. So again, as Mark said, it's a great marketing tool. And I'm prefacing all of this on the concept that it works. Now, if it doesn't work, which would shock me as an investor, if I'd lose my money, so be it. But if it doesn't work, we're not having this conversation because I'm not going to use it in my practice. But on the assumption that it does work, I have no problem differentiating my practice from all the practices around me who aren't using it. Now, there's no geographic exclusivity, right, Mark?
No,
So
there is not.
if every practice in my town wants to use it, they can all use it. And kind of like aligners, 15, 20 years ago, there weren't that many practices doing a ton of aligners. So if you did aligners, you got patients that nobody else did. It's probably going to be the same way if we follow the same kind of saturation curves that happen in medicine and dentistry. Do you perceive that at first people are going to buy it, they're going to stand out, they're going to help their patients, their practice is going to grow, and then as word goes around, more and more people are likely going to get it, right?
Yeah, that's exactly how we envision that, because we call leaders in the community where somebody would potentially look up to, and they were going to try it first, the early adopters. They're going to try it first, and then they will get new patients because of the results that you'll be seeing. And then eventually it will filter out to other practices. But initially, there certainly will be kind of one person in an area who will be let's call it the expert.
Yeah. And as studies come out, and again, I've said it 5 times, I'll say it again. The assumption here is that the studies will bear this out. There will be quotes of speed or shortening of time that people will be allowed to use in advertising, right? Let's just say, I don't want to put words in anybody's mouth. Let's assume at a very conservative rate, the studies show it gets a 25% reduction in treatment time, right? And that's in the study and it's published. Well, you're allowed to say to people, use of this device should shorten your treatment time by 25%. Now, why should? Because individual results vary, right? We all know that with biology. If I shave 20 people's heads and said, who's the first to 1-inch long hair? Not everybody's going to get there at the same time. And so would you agree that when the studies get published, those statements that are made in the published study are open game for people to advertise, right?
Absolutely. And we couple that with the FDA. When they give us our clearance, they're going to dictate what we can say. And because of the Brazilian study, there's already indications that the FDA has said, you need to put this in there.
Great. That's great to hear. So the last thing I'm going to hit here as we get shorter on time is at some point, we've got the folks who are going to do the multi-center studies. We know that already. You're looking for funding. So we're going to talk in a minute about how people can contact you if they want to learn more about how they can invest in this company at the beginning, because a lot of people never get a chance to invest in a startup. And it's not really a startup. You've been around a little while. But to invest in a company on the ground floor, so to speak. But the last piece of the puzzle is after the studies, you're going to need people who enjoy standing on stage and showing clinical results of I show, like I used to do for Henry Schein. There was a product of theirs I loved, and I would travel the world gladly talking about this product and showing, here's a case I did using it. Here's another case I did using it. Here's another case. And that dirty word key opinion leader, or KOL, is what I was for that product. You're going to need people like that at some point. So I assume if people are interested, pending the studies, obviously, nothing happens until the studies come out. But you're going to need people who are comfortable traveling around when they're at a meeting or on social media or wherever it is, showing the rest of our community what's working and why. Correct?
Absolutely. And I think that's a valuable piece to us as we get into the market, having those, what you call key opinion leaders, that's critical on the success. And it's a win-win for that key opinion leader and for the company.
Right. So if someone wants to learn more about investing or potentially throw their name into the hat as a potential key opinion leader, or representative, when I say representative of the company, I mean somebody who gets on stage at meetings and talks about this stuff. Again, pending all of the results that are coming out, nobody's asking you to do anything right now. How do they get a hold of you personally?
Sure. The best way to get a hold of me is through email. My email address, and we can give it to you later on.
No, you can do it right now.
Okay. It's Mark, M-A-R-K, at orthodonticell.com.
ORTHO, ortho, dont,
DONTICELL.
ortho, dont, DONTICELL.com. So again, it's a little bit of a longer name, but not that difficult to spell. So Mark with a K at orthodonticell.com. If people want to learn more about the product itself, I know is rudimentary. There's not a lot there yet. There will be. Where can they learn more about the product itself?
Yeah, absolutely. We have a website, and the website is www.orthodonticell.com.
Mark, I appreciate you for a whole bunch of reasons. Number one, this is an arena in orthodontics that takes a lot of guts to come back into. Right now, me just talking about it, I'll be a punching bag for a number of people. Why? Because we know the history. The road is littered with the corpses of companies that made promises about what they were going to do with speeding up treatment. But just like, the prescriptive bracket, to create straight wire orthodontics, it changed the game. Just like bondable brackets changed the game versus bands and having to swedge bands and what have you. This product potentially has the opportunity to change the delivery of orthodontic care, whether brackets or aligners, makes no difference in the United States and worldwide, obviously. So I want to say thank you from the bottom of my heart for being the guy who's leading the charge. Really looking forward to seeing how the studies turn out. How long do we anticipate the studies are going to go on, by the way? When will people be able to hear definitive sort of studies are done? We're getting, we expect to be published. How far down the road are we looking at? Is the guess?
Yeah, good question. So as I mentioned before, we're starting the FDA studies, the human studies. Those studies would take 6 months. So we're saying, January of 2026. After that, we have to do, for the FDA process, you have to do what's called an S&B, where you do the numbers to see, how did we do in the efficiency and the effectiveness in reducing time. After that, we do expect the FDA approval in Q2 of 2026. And so that's the time frame. So to hear about this on a shorter period of time, we will do that starting probably in January.
Well, thank you so much again, Mark. And remember, folks, Mark at orthodonticell.com. If you want to learn more about it, orthodonticell.com is the place to go. Looking forward to some great things. And like I said, I'm an investor because I believe in the company, I believe in the product, and I believe in, more importantly, the founder. I don't invest in products as much as I invest in people. And anybody who knows John Marchetto, and if you want to talk to him, I know he'd be thrilled to talk to you personally. Anybody who knows John knows he's not a salesman. He is the furthest thing from a salesman. He's honest, he's smart, he's humble, and he's a heck of an orthodontist. I would put his work and what he's done against anybody out there. And when I was in ortho residency, Doug Shaw, my partner, and I, we would go to his office after class because it was only about 15 minutes away, And we would just stand there and watch his cases and watch his finishes. And a little side note to everybody out there, when I was in ortho residency to make extra money, I did his indirect bonding setups on Sundays. I would go to his office and I would personally do all of his IDB setups. He'd put the brackets, cure them, and have them waiting for me. And I would do the Sandi technique for IDB trays with the PVS material, the single layer suck down, the second layer suck down. And that's what I did. So I got to see his bracket placement up close and personal, and I got to see how he did things. And let me tell you, folks, if you invest in people, this is the guy you want to invest in. And so, Mark, thank you for being here today. If I sound like an enthusiastic supporter, it's for all the reasons I've mentioned. So thank you.
Thank you, Glenn. And you're exactly right. John is a great guy. He's a great co-founder, and he is the real deal. And fortunate enough to be part of this. And we have a big road ahead of us, but we'll execute. So thank you very much.
Yeah. Have a great day.